Good evening. Welcome to another live stream from Let's Talk About Insulin series. Tonight, my guest is Emma Klatman, a Global Policy and Advocacy Manager at Life for a Child. Let's welcome her to the studio. Good evening, Emma.
Hi, Veronica. Nice to be with you tonight.
It's great to have you. So I would like to ask you first about Life for a Child, how it started, the organization that you work for.
Absolutely. So here we are in 2021, but Life for a Child's beginnings really take us to 1999. And at the time, the president of the International Diabetes Federation, Maria de Alva, she asked Professor Martin Sillink to establish a program to help young children and adolescents with type 1 diabetes in less resourced countries. Martin asked Dr. Graham Ogle, who is the general manager of Life for a Child, to work with him, and the Life for a Child program commenced in the year 2000. Things started pretty small. Clinics were identified that needed help in Papua New Guinea, Fiji, and the Philippines. The program worked, and young people were not only surviving the diagnosis of type 1 diabetes, but they were starting to thrive in ways that they had not before. And they quickly learned what it took to manage their diabetes. And slowly but surely from then on, the Life for a Child program expanded its reach to help more clinics around the world. And really a core principle of Life for a Child was always to partner with local clinics with the ultimate aim of supporting clinics through to sustainability. And today, Graham, the program's general manager, he's seen firsthand children go from diagnosis through to young adulthood. And he's published many scientific studies on the improved outcomes of young people who have been supported by Life for a Child. And today, as of November 2021, we're supporting roughly 27,000 young people in 48 countries.
Yeah, so you told a bit about the activities, but can you explain more? How does it work exactly?
Sure. Happy to kind of go into that deep dive. And I know I'm preaching to the choir here, in that this is such an amazing community, the diabetes online space, and it truly does make living with type 1 diabetes a bit, at least for me, it makes it feel a little bit less. It makes it feel less lonely. But type 1 diabetes is hard and can be burdensome anywhere you are in the world. But it's even harder in less resourced countries. The situation is far worse for people with type 1 in these settings, purely due to the lack of capacity and infrastructure in these settings. And this isn't just about, the price and the cost of insulin and blood glucose testing supplies. The challenge is really for somebody living with type 1 in a less resource setting really ranges, all the way from the beginnings, really with awareness from healthcare professionals about even diagnosis. And sometimes it can take too long for young people to actually be diagnosed in the first place because some healthcare professionals just don't have that education or awareness that young kids can develop diabetes. I mean, we've heard of horror stories where young people go in to hospital, like clearly in diabetic ketoacidosis, but then they are admitted for things like malaria or an ectopic pregnancy even, or tuberculosis. But we do think that situation is changing drastically, and many healthcare professionals are much more aware about diabetes in young people. in less resource settings. But even when young people do get the diagnosis timely, sometimes there are challenges. For instance, in being able to see an appropriate team of skilled medical professionals. Another component that's really tough about having type 1 in a less resource setting is access. In my view, I think access is one of the greatest challenges. Just to put in context, insulin it can be very expensive for young people and their families to afford, but oftentimes actually in the countries that Life for a Child supports, even the cost of 2 strips per day can outweigh the annual cost of insulin alone. So it's a lot, and it takes up, a big chunk of a family's income on top of so many other basic needs that families have, like eating, like having a roof over their heads, like sending their children to school, going to work themselves. And, oftentimes when a young person has to go to clinic or to pick up their diabetes supplies, oftentimes families have to take time off of work. And so there are, the direct financial burdens associated with access, but there are also those indirect financial burdens as well. And so, like with the example of test strips, it can be so hard to monitor one's glucose if the costs are so prohibitive. Just to share a little country example, progress is being made in terms of countries, less resource countries, providing insulin, but that situation really is not the same for glucose test strips. And I often say that, if you have having insulin is like having a television, but if you don't have test strips or any kind of glucose monitoring, you don't have a remote to turn on that television. But like I said, there is progress being made in certain countries with their health insurance systems, adding insulin into the health system's benefits package. Like in Rwanda, for instance, under the Mutuelle de Santé, human insulin is covered up to 90%, and beneficiaries pay just a 10% copay. And while that might not seem like a lot to you or I, even then it can be restrictive. But in the Mutuelle in Rwanda, test strips are not covered yet. And so while progress has been made there's much more progress to still be made. And then there's a country like Bolivia, for instance, where no kind of diabetes consumables are provided within that health system's benefits package. So even if one could afford, the enrollment fees to join a health insurance plan in Bolivia, there's not a lot of benefit for them because diabetes consumables just aren't covered. So it's a really challenging situation. And in the Bolivian case, people have to resort to buying diabetes supplies completely out of their own pocket at private retail pharmacies. But Life for a Child does support in Bolivia, but we will get into that in a bit. But I do just want to say, Life for a Child works to meet these sort of immediate needs, but that's not all that we do. We are proactive in the sense that we work in sustainability. So we have undertaken much research in, monitoring progress for universal health coverage of type 1 diabetes supplies in the countries that we support. We also work in publishing studies on country level epidemiology. So that's, how many people actually have diabetes in those countries, because a lot of that information is missing. And without that, without knowing what the true number of people living with type 1 diabetes is, it's very hard to, for government officials to be able to forecast accurately. We also do research on the costs of care And we also work in cost effectiveness, understanding cost effectiveness interventions that show that investment not only saves lives, but reduces costs to health systems. And ultimately, these interventions improve qualities of lives. So, our ultimate aim with this kind of proactive piece of the puzzle is to package up this very rich data we have and work with partners to arm advocates and present this to local stakeholders who can impact upon change.
That's great. You're doing an amazing work. I think not enough people are aware of the situation in different countries of people with type 1, children, youth, adults. And for me, I remember when I read the stories on Life for a Child website, I was really devastated, because I think that it's so bad that the place of your birth determines if you have access to a life-saving drug. That's really scary.
What you're saying reminds me of what Jean-Claude Mbanya said. He said that accidents of geography should not determine whether somebody lives or dies. And I think that with these interventions, including Life for a Child and many other fantastic other organizations, we're seeing that story shift a little bit, but that burden, that reality is still far too present.
Yeah, so let's go to the next questions. And the next one is, I would like to ask you, where do the donations go? So maybe you can explain the viewers, when they want to donate to Life for a Child, what happens next?
So it really is only thanks to the donations that we can do what we do, and donations are directed towards ensuring that every young person we support has access to the insulin, glucose monitoring, diabetes education, and ongoing care they need. And really, donations and funds go towards all aspects of care, from ensuring that a child can access glucose monitoring strips to something as, just trying to think, something as indirect as, for instance, the purchasing of, let's say, a vehicle, so that staff at a partner center that we work with can drive out to rural villages to deliver insulin supplies and care to those very hard to reach families. And donations also go to everything in between that, like HbA1c testing, syringes, and diabetes education materials, and also supporting diabetes camps that are put on by the existing diabetes centers locally.
Great. So every aspect, basically, of life with diabetes is covered.
Yeah. I guess you could say that, except for the kind of heavy sort of mental health burden and all of the sort of difficulties that come with it. But I do think that stigma, with work of incredible local advocates, I think that stigma is kind of slowly but surely being addressed. But it's a marathon, not a sprint, that one.
Yeah. So one of your campaigns, do I say it right? I hope, Sparrow Rose. It's well known in the diabetes community, especially online diabetes community. So can you tell us more about this? How does this specific action make a difference?
Sure. And Sparrow Rose is one of those absolutely fantastic community initiatives, and Life for a Child just simply would not be where it is today without the incredible support of Sparrow Rose. Sparrow Rose was started, I think, about 8 or so years ago by a group of members from the diabetes online community. And this began, Sparrow Rose had its roots in the United States, but it quickly became a global campaign. It's brought so much awareness about our work to corners of the globe that we would have never thought that we would have been able to reach. I can just think that in the last few years, Sparrow Rose has brought donations and really awareness of the work that Life for a Child does, from awareness all over the world, from countries like Japan and Indonesia, Serbia, people really who would have never known we existed if it wasn't for this campaign. And I just think from the awareness raising perspective, Sparrow Rose has been very transformational for Life for a Child in that respect. But it goes beyond that, really, just in terms of the huge, massive fundraising power of Sparrow Rose. Since I believe it's 8 or 9 years, over the last years, the campaign has directly raised well over $300,000 US, which really has enabled us to provide hundreds of children and young people with insulin and diabetes education materials. I think everybody listening will understand that the immense impact that has had. And I would also just like to thank you, Veronica, for your involvement in Sparrow Rose, because you've promoted it and you've made some wonderful illustrations that we have used, and we thank you so much for that.
My pleasure. Great. So my final question is, how can the diabetes community support Life for a Child? What we can do as people living with diabetes in, let's say, in Europe, for example, or in countries where, we don't have to worry about access to insulin, about the absolute basics, because this is how Life for a Child is working, right? It's not about it's not about if let's say that the newest CGM system is on the market. It's about really saving lives and giving access to absolute basics. So what can we do?
Well, I think there are a few ways that I can think of, and I'll start really with what I'm very gripped by, and for me that's about just spreading the word. What I mentioned about Sparrow Rose has had such enormous impact on Life for a Child, and so I think awareness raising is one of the most valuable things that can be done. And even just by following, Life for a Child on social media and sharing our posts with your family and friends really does help to build awareness of the issues faced by young people living with type 1, as you say, who aren't struggling to access life-enhancing technologies like CGM. They're struggling to access really the basics associated with just managing on a day-to-day level with diabetes. So please do follow us on Instagram. That's at Life for a Child. And I think on the awareness raising side of things, I'd also like to mention that we have held art competitions over the last few years where we've asked young people supported by Life for a Child to kind of depict what their life is like living with type 1 diabetes. And we've had such impactful entries that are visual entries, written works. We've also had a rap come in as well, which was really good fun to listen to. So please do check out the Life for a Child website to see the amazing artworks created by the young people that we do support. And you can also vote for your favorite and share that. And I think, there's also, of course, the fundraising side of things. In fundraising, it makes a real contribution to our work. And in the past, incredible individuals of many different ages have raised funds for Life for a Child through, for instance, a kind of diversary running challenge, sports tournaments, Facebook birthday fundraisers, and other creative events. So we'd love to hear from you if you have any fundraising ideas. And then finally, becoming a donor. We do rely on very generous donations to support young people living with type 1 diabetes around the world. And just a small amount can make a huge difference. I think, the Sparrow Rose campaign has really shown that. And it is safe and easy to make a donation at lifeforachild.org/donate. And I am sure most of you will be aware about the Blue Balloon Challenge, but this is you've got a blue balloon.
Yes, you probably heard it in the background.
No,
Good voice. Yes, I also would like to invite to take part in this challenge, because it's so easy to support Life for a Child, and you just have to make one thing on Instagram. So let's hear about that.
Yeah, sure. No, I was going to ask you, Veronica, is that a balloon filled with helium, or is it just air?
No, it's just air.
Okay.
It's on the ground.
Well, just to explain just a little bit about, and it will be short to explain because the Blue Balloon Challenge is so simple and awesome. So Medtronic has the Blue Balloon Challenge, and they have a video that they put out really depicting, what life is like living with diabetes. Having diabetes is like going about your everyday tasks and trying to keep a blue balloon in the air, which is harder than you can imagine. But, I think everybody can relate, everybody living with type 1 diabetes, and anybody who loves somebody living with type 1 diabetes can most likely relate to the message in the video. But essentially, so invited Instagram users to either use a filter, a blue balloon filter, or an actual balloon, as Veronica has, and just make a little story on Instagram, just in whatever kind of creative way you want. And for every story that tags at Medtronic EU, Medtronic will be donating €5 to Life for a Child. And that €5 can go a long way to supporting a young person living with type 1 with insulin and test strips. So it's a wonderful community initiative, and we're all very grateful to the community for taking part.
Yes, so it's very easy, and you can do it until the end of November. Am I right?
That's right.
You can post every day if you want.
That's right.
Yes, so I think it's great because it's so easy, and we can all relate to that since we are all living with diabetes. And and I tried doing some stuff and balancing the balloon, and it's really tough. Yes, so thank you very much, Emma, for joining me tonight. Thank you very much for explaining all about Life for a Child.
Oh, it's my absolute pleasure to do so, and thank you so much for the opportunity to just give a little insight into what we do.
Great. Yeah, so thank you everyone for watching. This interview will be saved, so you can watch it later if you want. And I invite you to watching the rest of the interviews. We'll have one last one in December. And that's all for tonight. So have a nice evening, everyone. Thank you, Emma, once again.
Thank you, Veronica.
Good night.